Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy, or you're just tired of not feeling like yourself, this space is for you. Welcome. Today we have a very special guest. I'm excited to have Dr. Zach Rubin with us. Zach, you and I have known each other for a few years now, right?
Yeah. And we've met in person at different conferences and chatted on the sidelines for a long time. You've been a mentor of mine for OIT, and it's just been really awesome getting to know you.
I know it's been great to get to know you and just kind of evolve in this process as social media emerges and also as we kind of transition in healthcare. I mean, so many transitions, but you're obviously a big personality and people know you, but I want you to introduce a little bit and just let people know like what's kind of your background, with your training with, I think you're in the Chicago area.
Yeah.
But what was kind of your background in some of your training?
Absolutely. So I grew up in the Chicagoland area. I went to medical school at Case Western Reserve University in Cleveland, Ohio. And then I did my pediatrics training at University of Illinois in Chicago. And then from there, I went to Washington University in St. Louis to do my allergy immunology fellowship. I was in the pediatric track, but as you know, allergists cross-train and take care of all ages. So I do take care of whole families. And I finished up right as the pandemic started. So I had to figure out, how am I going to grow a practice when I moved from St. Louis to the Chicagoland area? Even though I actually went into the town that I grew up in, it was very different, and everything was shut down. No social events. There was no way to go into primary care offices. And so I said to myself, a lot of people are starting to go online and spending their time there. A lot of physicians and healthcare workers were there. So I said, all right, let's go on. Let's connect with people. And it slowly but surely I started to meet with people. But I also saw the tremendous amount of misinformation online, not just COVID-19 and all the infectious diseases and public health issues that we're facing currently, but related to food allergies, as an example.
Right.
There's just so many of these unproven tests and treatments that are circulating online, and a lot of the nuance is lost. So I started out on Twitter and then made my way to TikTok, Instagram, YouTube, all these different platforms, just sharing people evidence-based information, doing some silly hula hooping to have some fun with it, and then sharing people's stories and trying to give people some perspective on what a particular issue is from a physician standpoint. And slowly but surely have grown to over 4 million followers. And I've got a book coming out called All About Allergies, which I'm really proud to share with people. The amount of knowledge that our specialty has and the nuance and the breadth and depth that people often think of us as just treating runny, stuffy noses, but we do a lot more than that.
Yeah, we do. I think it's fascinating we when people kind of realize the breadth and the depth of what an allergist immunologist does, because so many think all we do is treat ragweed, for instance, and it's like, no, it's a lot more than the itchy, stuffy, sneezy, wheezy.
Yeah.
We have kind of a breadth and a depth of what we do. Probably the biggest burning question out of your intro that I have is, when did you start hula hooping? Was that like from childhood, or was that, boredom during the pandemic because we couldn't go anywhere? Or what's the origins of that?
So the origins is I was about 9 years old, and being Jewish, I'd go to a lot of bar and bat mitzvah parties where they'd have these silly contests. One of them would be a hula hoop contest. And if you were able to do these tricks and last the longest, you'd win a prize. And the prize was, either something nominal or like a big thing. And so I was terrible. And I said to myself one day, Mom, I really want to teach myself how to do this. Take me to a store. I went to a sports store. She bought me 2 green hula hoops. I went into my basement and I taught myself for hours.
Yeah.
And I became like that dead ringer that I'd go to these, little contests, and I just, beat the pants off of people. And so
Dominate.
I just dominate. So people knew about that in those kind of circles, but I kept it kind of hidden for many years until the pandemic hit, and we're all sitting around doing nothing. And I said to myself, there's all these people dancing on TikTok. Why don't I hula hoop? Because I don't see too many people doing that, especially like a male doctor, right?
Right. With the bow tie.
With the bow tie, tying it and taking it off, tie it, whatever. And so it just became this kind of spectacle that I, will pepper in my content. And I just look at the trends and decide when is it going to be an opportune time to showcase this and bring some levity to whatever is happening in the world. But also, there's a little bit of a purpose to it too, kind of hidden in the sense that I actually used the hula hoop in my college admissions essay. I still remember this because I wanted people to understand that it doesn't matter where you come from, what your background is. If you have an interest in something and a passion in it, and you put your effort and your time into something, you could seemingly do a lot of different things. You'd be surprised. And so I talked about how if I put my mind to something, I could do it really well. And the hula hoop was an example of that. That's part of the messaging that I have in my platform, but also breaking barriers, because a lot of times doctors are seen on an ivory tower that we're inaccessible. And I want to be able to break those barriers down so that I can really level with patients, establish that rapport ahead of time. And it comes to the point now where when I have new patients coming in and they know my social media background, we're already hitting it off very quickly to be able to help them. And we've established that connection before I even walk in the door. So the hula hoop has a couple of different purposes in my mind. One of it is to showcase that if you put your mind to something, you could really accomplish anything. I actually talked about that in my college admissions essay, where I literally talked about my experiences learning how to hula hoop and these newer skills. Anybody can really be surprised by how well they can do something if they just put their mind and time and effort into it. But then also, when I do it on social media, it's a signal to my audience that I'm trying to break down barriers, that I'm just like everybody else. I can be goofy, I can be silly. Doctors are often seen as an ivory tower and inaccessible. And so by breaking down those barriers, when I have patients coming in who see me, who follow me, they've already established a rapport with me and a level of trust because of the work I put online, not only with the evidence-based information, the knowledge and expertise, but the way I present it and the hula hooping is a way to say, hey, this is just like a regular guy who's just trying to help out.
I really love where it started though with your passion, like just pure, genuine, like passion for it, no matter what that is. It's like start with the love and the passion and develop that into how you're going to serve, and you just kind of evolve that. And it really is kind of an amazing lesson to anyone, like no matter what that is, find that within you, develop that passion and just go for it, right? Unapologetically, just go for it.
Absolutely. This is such an important point too, especially if anybody's listening who likes to post online, and if you're thinking about even just growing a social media following, all of what we're talking about applies to that or to any life skill. That the more time and effort you put into something and develop that knowledge and passion for it, the more likely you're going to succeed.
Yeah. and and I think too, it's also not trying to copy someone, but also finding that passion and that what's uniquely you, and what's within you, and developing that, because that's going to make you unique, not trying to, it's like, oh, Dr. Rubin is amazing, he has the bow tie and the hula hoop, maybe I should do the same thing. Well, I can tell you, no matter how much time I devoted to that, I would completely suck at it, you know because that portion would not be uniquely me, right? And so it's like, as I've kind of done this, I've kind of evolved in what's me and what's my personality and who am I and what can I uniquely give, and where is my passion. And I think one of the things that you and I do share is a passion to dispel misinformation. Uh,
Absolutely.
and that's actually why I'm even online in the first place, is kind of like you saw several years ago. There was so much misinformation out there, and at times I feel like my voice is so small and insignificant compared to the massive ocean wave of misinformation that's out there. You kind of wonder, are we doing any good with this? Are we making any progress? But kind of within me, it's like I just have to try, and like my little small tiny circle of influence. It's like I can't sit still and I can't not.
Right. Well, let
So
me put some perspective on this though, because For most people, they think that their bubble is too small to make a dent, but that's especially not true for physicians, because if you think about the number of patients that you would see in a year, I'm sure it's a few thousand, right?
Hmm.
You know,
Yeah.
not over 10,000, I would assume. So
Right.
somewhere in that range. And
Right.
so you can make one post that can reach 20,000 people in a matter of minutes. I mean, the way you can disseminate information online is very different than what you do in a clinic setting. And so even if you have, I'm saying this for the general audience, even if you have 50 followers or 100 followers, you make such a bigger impact than you would realize. And I see this now with what I've been able to do, where I'm out in public and people recognize me and say, "Oh my gosh, like what you do is so appreciated." And
Yeah.
so whether or not you're giving that level of expertise and care to 5 people or 5 million people, it doesn't matter. You're still making an impact that can't be measurable at this point. We don't have the tools to be able to measure that level of impact. So if you think you're not doing anything, that's not true. You just got to keep being persistent, and you will make a difference.
Yeah. That's awesome. As docs, a lot of times we face like so many challenges every single day. And for me, we go through all this training, we do all the things, and I've been in practice a little bit longer than you have. I finished training back in 2008, and I didn't face a pandemic coming out, but it was the housing crisis that actually hit in 2009 when I was trying to start my own practice. And so, things have kind of evolved, but for me, it's like medicine and listening to patients and delivering care is almost the easiest part of what we do. But we face significant challenges, and my top three are kind of the government, insurance, and influencers, like combating misinformation amongst influencers. What do you kind of see, and what's your perspective on maybe you in terms of what challenges you may face, but then also thinking more globally, the challenges that docs face? And part of the reason is I actually talk a little bit more about this in a different podcast that I do, where, influencers, for instance, they're not beholden to anyone. They're not docs. They don't have to give any kind of recommendations. At the end of the day, if they go wrong, they always say, well, go talk to your doctor.
Mhm.
But they can scale cache things with a whole bunch of misinformation because they're not giving medical advice. A lot of the supplements that are being, pushed have no oversight. Yet we
Mhm.
as docs have to prove medical necessity for everything, rightfully
Yeah,
so. But we
yeah.
do, and we can't scale those things. But anyway, there's some challenges that are in the way. What kind of do you see, again, kind of personally, but also more globally?
Right. I mean, I agree with you, those three things being the top of the top, but I'm going to reframe it just slightly differently, which is I think the biggest challenge that we face overall is public trust right
Yeah.
now.
Yeah.
That is at an all-time low. Uh, that encompasses all of the things that you were mentioning in terms of the government, in terms of insurance, and influencers, and how that space has evolved over the last 5 6 years. So I'm going to be very frank with this. The
Good.
COVID-19 pandemic has exposed a lot of the systemic problems that are within our healthcare system, and public health communication as well. So
Yeah.
when we think back in the beginning of the pandemic and how it evolved, the communication that came down was rushed. It was very authoritative and changing quite a bit. The level of humility did not really come out in the media. When something changed, it wasn't, the science of this and our knowledge evolves over time, and we need patience, because the reality is we don't really know what's going on all the time. That level of humility was not communicated well.
Yeah.
And so a lot of people became turned off on it when politicians and influencers came in and capitalized on that, saying that people were lying to you. It wasn't a matter of a lie, it's a matter of the shifting scientific process that happened. And we just did not communicate that well. We're all
Yeah.
kind of building the ship and driving it at the same time. So that's really, really challenging to figure out what is best when we're in a once in a generation pandemic. Over 1 million people died in the United States, and millions are suffering from chronic debilitating issues that are related to it that we're just scratching the surface at this time to understand. And so that's led to vaccine uptake decreasing. That's led to an increase in distrust. It's led to the people who are currently in power right now. And so, that is something that is such a difficult challenge that we face, because the policy decisions that are being made right now are not necessarily in truly the best interest when we look at the best available evidence. And so, what you and I are trying to do a lot is trying to give people nuance and the evidence and what the reality of the situation is, to try to build that bridge back and to rebuild that trust. And I think it takes humility, honesty, empathy, and patience in order to overcome that. In addition to the fact that, like you mentioned, taking care of patients is not nearly as hard as dealing with the administrative burdens that
Yeah.
we have in an ever-changing landscape in healthcare, where we have diminishing reimbursements. We've got
Yep.
corporatized healthcare where there's a lot of private equity that are buying up practices. There's very few private practitioners. I'm in a small private practice, and so I'm relatively insulated, but it's a big struggle when we have inflationary pressures. We have rising costs of syringes, yet we don't have increased reimbursements to cover the costs of that,
Right.
as an
Right.
example. Or insurance companies create these new rules to cut back on what they're able to reimburse.
Yep.
Like I don't know about in your state, but in Illinois, if I have a PPO patient who's coming in for an office visit, they can't get their immunotherapy injections the
Right.
same. They put barriers up like that, just as a small
Right.
example of that.
Well, and going along with that, not only the cost of syringes, but I don't think a lot of people realize this, but in a medical practice, for instance, when you have your staff, or if there's a staff there, it's like, well, how is that staff, for instance, getting paid? Through what a doc bills out and gets reimbursed.
Right,
It's not like they can, the staff can't do any of that. That it's solely what we're. But when our reimbursement continues to go down, the costs of everything else goes up, and then we
right,
we still need to pay that staff, according, give them raises, and rightfully so, to match inflation and all of the things. It's like there are many. It's such a systemic problem, and there's so many practices just struggling day in and day out to survive. And what's fascinating is when I talk to administrators, their answer is always, how can the docs do more with less, basically, right?
right.
The answer is never, hold on, insurance is the problem,
Exactly,
because
exactly.
like we're seeking for solutions that don't address the actual problem.
Right.
And
No, I have to say, the insurance bloat with administrative costs is crazy.
yeah.
What people don't realize is, if we prescribe a medication that's expensive, we have to
Mhm.
do a prior authorization. And that is a level of paperwork that often you hire staff to do that for you, because you just don't have the time necessarily to do all of it. But that is unpaid
Unpaid.
time, right?
Yeah.
It's not reimbursed by insurance companies. And so, and it's all well and good to practice the best medicine, but if it's not covered, or you have to go
Right.
through all these mountains of paperwork to do, doctors burn out regularly from that, and it causes practices to shutter up if they can't, keep going with it. So you either have to see more patients and give lower quality care, or you got to somehow, go, like a lot of people are doing this. They're going into this hybrid kind of concierge care medicine route, where you have to pay a subscription fee to be
Right.
able to access the services at this point. Or sometimes they'll say, pediatrics does this a lot. Okay, you got your school forms. If you're not doing it at the right time, we're going to do like a $75 charge or whatever it is. It's just, it's there because you got to keep the lights on.
Right. Exactly. And I was just thinking, you've mentioned a few times, on some of your social media, that your dad was a pediatrician.
Yeah.
Is he still alive,
Yeah.
practicing, or?
He's practicing. He's alive. We moved out to this area when I was born, and he was in the same building up until about like 5 years ago, like right around the beginning of the pandemic, and the hospital system got merged, and then they bought his building, which was privately owned. They bought the building, they kicked everybody out, and he had to move within 6 months, which is
Yeah.
insane.
Yeah.
So he's still practicing, working hard. He refers me patients, which is fun.
That's awesome. He's probably seen even more of kind of this whole transition. And what are some of as him being a pediatrician and you probably watching that through the years, what are maybe two or three key lessons that you've been able to glean from him?
Yeah. It's interesting that you bring him up, because, and we're talking about the changing landscape of healthcare. Um, what's fascinating to me is that when I was a kid, pediatricians were still doing this. They did everything. So if my dad was on call, this is what would happen. I remember vividly, I'd wake up at 2, 3 in the morning. I'd hear the garage door open because it had this really loud creak to it.
Yeah.
And I was right above there. He would go at 2 in the morning to the emergency room because a kid was potentially having meningitis, and he would do the spinal tap himself in the ER. He would admit that patient. He would then
Yeah.
round on the patients that were on his service. He would then go to clinic, take call from clinic if the nurses needed anything, then go back to the hospital, round on those patients, and then go home just to
Yeah.
take call again, and rinse and repeat. And he shared that for a while with just one physician, then it became two for their practice. And so it was grueling work, but you really saw through the entire care for them,
Yeah.
right? Whether they're in the clinic or in the hospital, you took care of everything. And this is pre-rotavirus vaccine, as an
Right.
example, right?
Right.
Or modern day meningococcal vaccines. And so you'd see a lot more severely ill kids. And with vaccines, a lot of the illness has changed. As an example, you have
Yep.
a lot of these kids who were, born prematurely, who had a lot of comorbid problems related to, what happens in the neonatal ICU, who have these chronic issues. It's not like you have all these acute infectious disease issues where kids are dehydrated, meningitic, all those problems. They're not there anymore. Kids aren't dying at the same rate. So it's a totally different landscape. And now we have hospitalists, where you have doctors who primarily just work in the hospital. They don't do clinic duty. And then you have your primary care physician mainly just see patients in the outpatient. And so there's a disconnect that
Yeah.
happens there. And so the lesson that I've seen just from viewing my dad is continuity of care matters. It
Yeah.
matters so much that you know exactly what's going on with your patient. You get to know them like they're your family, because once you have that kind of a relationship, you can provide the best level of care, and you have garnered the most amount of trust. Part of the reason why I went into medicine was, I remember there was a take your kid to work day in middle school. I went with my dad, and there was a family who had been seeing my dad for a number of years, and the dad was this big guy. His hands were like 5 times the size of mine at the time. And he shook my hand, and it
Yeah.
felt like he almost broke my hand. He goes, "You should be proud of what your dad does. He does such a noble
Yeah.
duty to help my family and other families. It would be an honor to be just like him." And it just stuck with me, that level of grace and humility, that you get to do things where you're helping people in a way where they're opening up to you about their worries, their fears, and you are intervening at vulnerable moments in their life. I mean, we see this all the time with, newly diagnosed food allergies, as an example. It's a very
Yeah.
vulnerable moment, and you get to make an impression that lasts with them potentially for a lifetime, as an example. So it's a real honor to be able to help people this way. And my dad has always been a very hard worker. And so I always feel like I can never match his level of intensity sometimes with how hard he works.
Yeah.
Although I think I've finally gotten there at this point with all the stuff that I'm doing. But he always imparted upon me that, just like with the hula hoop story, if you put the work time and effort into something, you put your mind to it, you can do anything.
Yeah.
And I think that's such an important lesson for people, that you just got to put the work in. I mean, that's why professionals are professionals, because they
Yeah.
put the work in.
Yeah, they're the ones doing the things that nobody else is doing, that are unseen, kind of behind the scenes. But I was thinking, as you were talking about all the things that your dad used to do, and kind of back in the day, and the continuity, it's kind of like, though, his ability to care for patients and deliver medicine outweighed the administrative burden. And I think part of the problem with our fragmentation of care now is the administrative burden outweighs the time that we have to actually give care, right?
100% agree with you on that. Yeah.
And it's like, somehow we've got to get back to doctors being doctors and being able to actually deliver that care and and somehow reduce that administrative load.
Right.
Um, but so what how can we make a change? Like how can we this is such a large systemic problem with
Right. Right.
so many moving parts and people in certain leadership positions currently that are taking us in a direction that is going to reintroduce diseases that you were talking about before that we've forgotten about.
Right, exactly.
It's-
I mean, in all honesty, I can't think of really any significant initiatives that this administration has put in place that's going to really, truly impactfully improve. I mean, truly improve on patient outcomes and on health. I believe the president just introduced this great healthcare plan, which is just basically piecing all together the talking points they've been talking about for the last few
right,
months,
right.
codifying the most favored nations, which is this idea of saying, well, if Germany has the lowest price on this drug, this is the only price that we're going to pay as a country. And that doesn't make sense
Oh,
because we're not a nationalized health system. We don't have the negotiating power to lower that cost. So not only that, when you have a nationalized health system, you have a smaller formulary. These are the drugs that we're willing to pay for, and that's it.
yeah,
So you don't have that level of choice that people think that you have.
yeah,
So, and here's the thing. I am actually a proponent for a universal system because if you have
right.
one payer that represents 330 million people, you're going to be able to decrease the cost of care very quickly by having that negotiating power. It's like Costco, like to help people understand, it's like Costco. If you have a membership and everybody pays in, they're able to negotiate a lower price per product by doing that. It's basic economics from that standpoint.
Well, and even the electronic medical record system, if you had a unified system instead of all this fragmentation where, we spend so much time just trying to get records and communicate and, it's impossible. But like when I hear the current administration and those leading, honestly, what I hear are just oversimplified influencers.
Yeah.
That's that put anecdote and association far above evidence and what and nuance, and one of the things that I often talk about is you have to get past a headline, you have to get past clickbait, you
Yes.
have to dive into the details. And unfortunately, with social media, it's all about the 15-second clip, right? The hook, the
Yeah.
story, the close, those 15 seconds, 30 seconds, little snippets. And so everything is so oversimplified that people without a base of knowledge or whatever, and I don't mean this in any derogatory way, it's just if you don't have that base, if you haven't, getting back to your hula hoop, if you haven't put in the hours and hours and hours of practice, you're just not going to have the skills.
Right.
I haven't put in the time to of the hula hoop practice. I don't have those skills that you have. I can't speak
Yeah.
to that.
Let me
You
ask you a
know,
question.
yeah,
This is an important question. So when you travel, do
hmm
you go to the pilot and tell them how to fly the plane?
right. No,
Right? Anybody do
no,
that? Or if there's a fire, do you tell the firefighter how to put out the fire?
no,
We don't. So
we
why
don't.
is it any different with healthcare? And it's not to say that people can't question things for their own personal health. That's not what I'm saying by this.
Right.
It's the idea that you have people who are not physicians demonizing physicians
Yes.
constantly online when they don't have a basis to understand the nuance and the level of complexity of the human body. I think we need to get back to the basics of humility and nuance to
Yeah.
say, hey, I know certain things very well and I have the ability to do certain things. But if there's an issue related to law, I'm going to go to a lawyer. If
Right.
there's an issue related to, hey, I want to learn how to cook something, I'm going to talk to a chef or a dietitian. The
Yeah.
expertise matters. And in this day and age, what social media does is it democratizes the expertise.
Yes.
I've said this on my live streams before when we talk about like oral immunotherapy. I say, I've got a mentor, this guy right here, like
Yeah.
these are people I lean on. And
Right.
and yes, I know a bit, but like I'm not the pioneer. I
Right.
have a different level of expertise and I know what my limits are of what I'm able to talk about and what I can talk about. It's something where you're going to always find somebody who knows more than you about something. And I
Sure.
think people remember that. So yes, healthcare has a lot of issues, and we've talked about some of the ways we could potentially improve it. But saying that all doctors are bad or don't know what they're talking about, they're lying to you, is only a dog whistle for furthering somebody else's agenda. The phrase gold standard science and radical transparency, it's just not founded, and then if you're saying you're radically transparent, why are you not being radically transparent?
Right. Right. Yes, exactly. And to me, it's like the greatest impact in things comes in the nuance. It's not in the dumbing down of everything or trying to get some kind of clickbait. It literally, the greatest impact comes in the nuance, and you have to rely on those that understand that nuance and have kind of that level of expertise. And to your point, have that humility instead of just pointing the finger, demonizing doctors. And I think pediatricians have been some of the most demonized, and to me they're some of the most, you know, gracious docs that are in existence. If you look at all of the specialties, it's like pediatricians of anyone, get paid the least or and are taking care of the children, but have been demonized. And it also creates what you were talking about earlier, that distrust.
Yeah,
It furthers that distrust that we have.
it bothers me to no end how other specialists will make things up about what pediatricians do. There's this myth that pediatricians get paid millions of dollars to vaccinate children.
Right.
That's, I mean, so there was an ENT doctor who said that if she was vaccinating for COVID in her clinic, she would have made $1.5 million.
Yeah.
And that is nonsense. Like you could easily debunk that. It's like what Medicare pays about
Yeah.
$45 an injection. That means you'd have to be vaccinating like 300 people a day every day you're open for a year to
Yeah.
make that level of surplus in terms of net profit, because you're not even accounting for your overhead. It's
Yes.
just it makes no
Exactly.
sense. My dad administered COVID-19 vaccines for a long time, and he had to get a deep freezer. He had it donated from a local university. It was a big deal to get all that off the ground. He was one of the first in our area to actually do it for the general public. He vaccinated the clergy. He
Yeah.
vaccinated firefighters, policemen, and it was a public service. But he made pretty much zero money on that. He was just
Right.
able to keep the lights on. And this idea that doctors get bonuses for giving vaccines is just ridiculous.
Yeah, I've never seen one. That's for sure. Nothing like that. So, um, you'd mentioned before, and it's behind your head there, All About Allergies. Your new book. Give us some clickbait so that when it comes out, we want to dive in on the nuance.
Yeah, yeah. So let me tell you the story about the book. So a couple of years ago, I got a message from one of my followers who is an editor for one of the imprints of Penguin Random House,
Oh
and
wow.
said that in her line of work, she can't do a book like this. It's like that's not like what her specialty is. But she said she really wanted me to write a book about allergies because there's very little literature out there for the general public
Yeah.
that has been widely circulated. And she said, you have a massive following on social media. You could really make an impact for people like myself and my daughter. They have some mast cell related issues and concerns
Mhm.
about it. So they hooked me up with a few different agents to talk to.
Right.
I signed on with Park, Fine, and Brower, and had two agents with them, Mia and Sarah, who are amazing. They helped me with the whole process of actually putting together a proposal, because that's the kind of the book writing process. And right before I did that, I'll be honest, I want to take a quick step back. I was like very busy and nervous to write a book, and I was having some cold feet. And my wife said to me, if you don't do this book because it's so important, I'll be your ghostwriter and write it for you.
Yeah.
She's a immunologist, and so she's published, and I've published too, but not in the book writing sense, just in the
Right.
academia. And
Right.
so I was like, okay, that's the kick in the pants to do this. And
Yeah.
so after they helped me write this proposal, it immediately got interest amongst multiple publishers. So I signed on with Plume, which is an imprint of Penguin Random House, and I got the best editor who was just very hands off. Like, you do you, like, I'll look at each chapter, but, didn't have to worry about line by line edits until like way later. So I got everything out. I was writing every day about all these different issues. So there's three parts to the book. The first is just setting everything up, understanding anatomy, physiology, immunology, understanding what it's like to go into an allergist's office and the nuance of testing. And we talk about sensitivity and specificity and really get down to the nitty gritty statistics that are important for people to understand. And then part two is looking at all the diseases that we deal with: allergic and non-allergic rhinitis, sinusitis, nasal polyps, chronic hives, angioedema, medication allergies, vaccine allergies.
Yeah.
We talk about all these different topics in the meat of the second part. And then the third part is about future directions, therapies, things that we can look forward to, ways to help improve upon your health. And I do the entire book, except for some of the first parts of the book, in a narrative style where I take patient stories or followers who I interviewed, and I take that story and thread it in kind of like a case-based discussion that
Sure.
we've done in medical education to make it as user-friendly as possible. And when I didn't have a story, I'd use analogies to really help hone in and focus in on this complicated concept and make it as easily understandable as possible.
Sounds amazing. Well done. Do you know when it's actually coming out? Do you have a date or?
It's coming out February 24th, so it's available for pre-order right now. Pretty much any major retailer that you get your books, you can find it. I'm actually actively recording an audiobook for it right now with my voice.
Oh, good.
So I did 3 sessions already, and if you've never recorded an audiobook before, folks, it is exhausting and very difficult. I've had some experience in high school with speech team. I did radio speak. So I have some experience with like oration and reading things aloud, but not for 8 hours straight.
Right. That's a lot.
Like my throat was so sore at the end of each day, and I was just like physically and mentally drained. I was really surprised by that.
Yeah, I can't even imagine. I bet that's so exhausting. But we're all excited for it, and massive congratulations to you. And we're looking forward to the launch.
Thank you so much.
With this podcast, it's called the Immune Edit because what we want to do is it does kind of focus on dispelling misinformation. But really, at the end of each one, I like to give a few edits, that perhaps people could make to be a little better, shift maybe one thought process or one habit or whatever. As you interact with so many people and see, the vast amounts of misinformation out there and people really struggling to know who to trust, how to even digest certain information. As you think about all of that, what would be Zach Rubin's maybe 2 or 3 edits that the public could make to just calm a little bit and maybe have a little more trust and even know who to trust?
Right. That's a wonderful question to leave on. So my number one piece of advice for anybody who's listening is verify before you amplify. So you may see something come up on your feed that looks very scary or too good to be true. You need to see who is that person giving that information. And it doesn't take much effort, but you just have to do a few clicks to get to their profile, see if they've got a public facing biography. Do they have a list of credentials to be able to talk about whatever it is? We are board certified allergists. I also maintain my pediatrics board certification as well, and so we have all of that listed, and we've got websites where you can really verify, our level of expertise when we talk about things. So just getting that before you then say, okay, I'm going to share this with people, because what you share will then dictate what you see. And the more that you share something, if it turns out to be not true, you get funneled more misinformation. So that's why when you amplify things, you got to make sure you're amplifying it from sources that you trust. I think the layer of complexity to this is the fact that we have a public health system at the federal level that has been compromised. So we have to be, unfortunately, a little bit more mindful of that. And I always say, turn to the medical societies now, the American College of Allergy, Asthma, Immunology, American Academy of Pediatrics, et cetera. All these different medical organizations are still publishing evidence-based practice guidelines, materials that you can look at that oftentimes are, user friendly for the general public to look at. So
Yeah.
finding those sources is really important. And remember that when you are interacting with people online, you can't always verify if they're real people. There's a lot of these computer generated bot accounts. There's people who are just paid trolls who will get you under your skin, aggravate you, or potentially confuse you. So always be careful about who you are interacting with online.
Great. Love it. And one of the trusted sources, I'm going to give a little plug for the nonprofit organization that I'm the president of. If you're looking for trusted food allergy information, food allergy support team, we're in our 10th year now and do an
I've
annual
been,
conference.
oh yeah, I just need to get to that conference.
Yes, you do. But this is our 10th year, and we do an annual conference, and we publish several articles, and we really have a nice collaboration, trying to get the latest and greatest of best diagnostics and therapeutics for our food allergy population. But
You guys have done a tremendous job with that, by the way. I just want to say I'm very proud of the work that you do with that. You've really given a lot of hope for many patients, not just locally for you, but
yeah,
around the U.S. and beyond. With you know working on oral immunotherapy as an example. And
yeah,
so for those who don't know, I've been a part of your organization. I think it's been like 6 years now. I've been on the email list and interacting. My practice went to one of the first meetings,
yeah,
and that's how they got started. So we're grateful for that. And so I've learned from them, and then I've also learned from you, and sat in on some lectures, and I love what you do. I really
thank
do.
you.
I'm just so honored to be able to not only work with you as a colleague, but as a friend.
Yeah,
So it's
yeah,
been awesome.
same. Thank you. That means a lot, and it's been awesome to develop our friendship over the years. And wishing you all the best, and thanks for your time today. And keep doing what you're doing, man. You're making a huge impact, and it's an honor to know you. So thank you.
Likewise, thank you.
Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.